Today on Global Health Frontiers.
In the Philippines, children are still suffering from the lack of micronutrients. It's called hidden hunger.
The child was hospitalized for malnutrition.
This is the longest running rice crop in the world. Genetic modification is essentially a speeded up version of traditional breeding.
So if you walk into any of our communities, the first thing you see are the traditional cook stove.
There's something wrong with your baby. The malaria situation is very serious here. We are only halfway to the gold mine. If the miners contract malaria, when they go back home, they will take the parasites with them and spread the disease.
It is a defining challenge of our time. Bringing modern medicine to hundreds of millions suffering from preventable and treatable diseases and conditions of poverty. Eliminating infections in many areas and tracking the sources of deadly global pandemics. With new advances in resources, science, and skills, pioneers on the frontiers of global health offer hope for healthy, productive lives. These are their stories.
Global Health Frontiers is made possible by support from the John Moores family.
For centuries, the people of Asia have relied on rice as their major food crop, and it is now a staple food far beyond Asia.
So rice is fundamental to global health. It feeds about 3.5 billion people.
In developing countries, amid population growth, poverty, and the emerging challenge of climate change, families rely increasingly on rice as a relatively low-cost food.
The families rely on giving rice for breakfast, lunch, and dinner. It's mainly rice that's being eaten by the children.
But a diet heavily dependent on rice has been linked to serious nutritional problems among children.
Rice does not have vitamin A, zinc, iron,
leading to lives of physical and cognitive struggle. Scientists are responding by developing new breeds of rice that provide more complete nutrition, including a controversial genetically modified variety from researchers in the Philippines.
In my work, I travel around the Philippines and look at malnutrition in the country and find solutions. My name is Ellen Villate. I'm a public health nutritionist here in the Philippines. This week, I'm traveling to Antique Province. Good afternoon. I'm happy to be here. Nice to see all my friends. This is where the vitamin A program started. 27 years ago, we did a study of the situation in the province. And what we found out was a very serious problem of vitamin A deficiency.
For the local health care center, vitamin A deficiency is common.
We found a serious problem of xerophthalmia. Xerophthalmia is the dryness of the eye. So this is blinding conditions of the vitamin A deficiency.
This boy will be blind in his left eye forever.
During the time that we were conducting the survey, number one findings was dryness of the cornea and, of course, night blindness. After giving the 3 doses of vitamin A, all the symptoms and signs are beginning to disappear.
One single capsule, taken at the right moment, can save a child from going blind.
Xerophthalmia has been eliminated in the country, mainly due in part because of the intervention. But the real story is we still find micronutrient deficient children.
So we're going to visit a family with malnourished children.
Antique province is the highest in terms of malnutrition in the entire region. In the Philippines, children are still suffering from the lack of micronutrients. Micronutrients are small nutrients needed by the body. We only need a very, very small amount daily in the diet.